Hello, and thank you for joining me today. My name is Joanna Sullivan, and I'm a registered nurse. In this presentation, I will be discussing the evidence-based plan to improve outcomes for a 65-year-old male patient that has been diagnosed with congestive heart failure. I will also examine the benefits and challenges of remote collaboration and providing care for this patient. Congestive heart failure is a chronic condition in which the heart struggles to pump blood efficiently, leading to symptoms like shortness of breath, fatigue, and fluid retention. In this case, a patient lives in a rural area with limited access to specialized care, which poses challenges for management. Despite these challenges, a remote collaborative care approach involving a primary care physician, cardiologist, nurse, and pharmacist have been proposed to improve the patient's health outcomes. Today I will walk you through this evidence-based interventions that can be implemented and the remote collaboration process used. The patient is a 65-year-old male with a congestive heart failure and a history of hypertension. He has symptoms including shortness of breath, fatigue, leg swelling, which are classic signs of congestive heart failure exacerbation. The healthcare team is collaborating remotely to design a comprehensive care plan that addresses both pharmacological treatments and lifestyle interventions to help improve his health outcomes. As part of the evidence-based care plan, we'll first look at the pharmacological interventions. According to the cardiologist's recommendations, the first step in managing congestive heart failure is initiating medication therapy. Evidence supports the use of ACE inhibitors and diuretics for reducing symptoms and improving cardiac function. ACE inhibitors is a class of medications that are commonly used with congestive heart failures. It helps to reduce the workload of the heart by dilating the vessels. Enalapril or lisinopril would be a example of that. And then the diuretics, which is Lasix or furosemide, they help control the fluid retention by helping your body to get rid of the excess fluid, which is crucial for this patient given the symptoms of his leg swellings and the shortness of breath. These medications are essential in managing the congestive heart failure effectively, as it's been shown to reduce the hospitalization, readmissions, and improve the quality of life for patients suffering from congestive heart failure, according to an article by Martinez et al. From 2020. Another part of the evidence-based care is using telemonitoring for the vital signs and symptom management. The nurse's suggestion of implementing telemonitoring as a key intervention. Research has shown that the remote monitoring of vital signs such as blood pressure, weight, and oxygen levels can help detect early signs of deterioration of the congestive heart failure patient. This allows healthcare providers to intervene before symptoms worsen and potentially prevent unnecessarily hospitalizations, according to Burt et al. From a 2021 article. A telemonitoring system that tracks weight fluctuations, blood pressures, and symptoms such as shortness of breath will be crucial for the early detections of exacerbation. It's also important, to educate your patients to keep track of maybe their daily weight or their weight every other day, to maybe even monitor and measure the size of like their calves or around the top of their feet or their ankles if that's where they're seeing the most swelling, to where they can notice those subtle changes in those measurements to help to alert them that they may be getting into some problems, and they could start then restricting their fluids, watching their sodium intake, or they'll know before they get really bad that they need to contact a physician for further instructions. And patient education and the medication adherence is also part of this evidence-based plan. And a pharmacist can help with some of the education with the medications, with the family and the adherence, and help to stress adherence to that. It says evidence suggests that patient education significantly improves medication adherence, which is essential for managing chronic conditions such as congestive heart failure. The pharmacist should provide counseling on the correct use of the ACE inhibitors, diuretics, and other prescribed medications, as well as some of the side effects to look for. And they should also educate patients on lifestyle modifications, such as dietary low-sodium diets, monitoring your liquid intake, or any other foods that may interact with some of the medications that they may have been given, that they have to take to manage that congestive heart failure. And a fourth part of the evidence base is regular virtual follow-ups, and especially if they're rural, they don't have hard to get access to transportation. Virtual has become pretty common practice these days, and it really helps with people who are in more rural areas, or some of the elderly people who no longer drive or have a vehicle or have someone to bring them to the doctor. They can do these virtual appointments, and if they've got ways to monitor their weight and blood pressures and stuff like that, that's also a help, because they would be monitoring their weight and blood pressures if they were in an office setting. And it says the doctors have suggested that regular virtual follow-up visits will allow the team to access the patient's progress and to adjust the treatment plan as needed. Research shows that virtual follow-ups for chronic disease management can be as effective as in-person visits, especially when the patients have access to technology and are engaged in their care. And that's according to Greenwood from a 2019 article, and that is really before the virtuals more took off since COVID. So even back before it became more commonplace, it was proven that it can be a very effective means for these patients. The virtual visits will enable the healthcare team to provide timely interventions, discuss symptom changes and management, and address any concerns that the patients may have. The remote collaboration or benefits and challenges. The benefits of remote collaboration has proven to be highly effective in managing chronic conditions, especially for patients in rural areas who face barriers in accessing in-person care. In this case, the ability to have a virtual meeting between the primary care physician, cardiologist, nurse, and pharmacist is a significant advantage. It allows for continuous coordinated care without the patient needing to travel long distances for specialist consultation. Additionally, remote monitoring systems allow for real-time data sharing, enabling the team to adjust the treatment plan based on the patient's current conditions. According to Davis and McEwen, research supports that collaborative remote care models improve patient outcomes by increasing access to specialists and enhancing patient engagement. The challenges of the remote collaboration are there. One of the major is technology access and literacy. The patient must have a reliable internet access or be comfortable using the telemedicine platforms and remote monitoring tools. Not everyone has cell phone service where they live, so if they don't have like a cell phone service that they could use, like a FaceTime or a video conferencing app on their phone, they would need to have internet in the home. And for the older adults living in the rural areas, it may not always be that they have one or the other. And then with the older population, some of them are not as tech savvy and are comfortable using that. There can be delays in communication and technical difficulties when using any kind of technology, remote apps and processes that would affect the timeliness of the intervention, which may affect and cause a less effective delivery of care if the kinks and stuff can't be worked out. additional consultations. Given the complexity and management of congestive heart failure, additional consultations, maybe with a dietitian and social work, may be warranted. The dietitian would be beneficial to help to educate the patient on a heart-healthy diet, especially regarding the sodium, which would helps to cause some of the fluid retention. Social worker can also be considered to help address any psychosocial factors that may impact the patient's ability to adhere to a care plan. They can also help address any kind of financial concerns and may be able to connect them with resources that could be provided within the community that may help them. In conclusion, providing evidence-based care for congestive heart patients remotely can improve patient outcomes, especially when a collaborative team approach is used. Pharmacological treatment, telemonitoring, patient education, and regular follow-up visits are all evidence-based interventions that can improve the management of congestive heart failure and reduce hospital admissions. While remote collaboration offers significant benefits, such as increasing access to care and improving patient engagement, challenges related to technology access and literacy must be addressed to ensure successful care delivery. By combining these evidence-based interventions with effective remote collaboration, we can improve the outcomes for our patients with congestive heart failure. Thank you for your attention.